Hello everyone, welcome back to Yasna's Path. Here we are in and learn together. I'm Yalini, your nursing tutor. Today we are going to dive into the topic of large intestine from applied anatomy for the students of BSc nursing first year. Let's go into the topic. By the end of this video, you will be able to know the large intestine structures and also how to apply this knowledge in the clinical scenarios for the point outing the constipation risk and preparing for the colonoscopies and you also able to understand the foundations of all the comparatives in the anatomy. Let's go together. The large intestines in your body is a final digestive checkpoint where the 5-meter long overall. It transforms the liquid food base from the small intestines into the solid stool, absorbing the water and electrolytes while pushing it towards the eliminations. Think of it as the compactor in your gut. Common issues, everyone's know that the common issues of constipation, which is of lower fiber, and also the diarrhea, which is from the infections, up to serious one as well, like colorectal cancers. The prevention is a key. Eat fiber-rich foods and quit smoking and get regular screening after 45 years old. As a nurse is pointing out these signs earlier, like abdominal pain or the blood in the stool, can saves the lives. So healthy habits start with the understanding. First steps is of cecum is a pouch like a starter about 3 inches or also or 8 centimeter long. Sits in your lower right abdomen. It receives it and their mushy waste. And this part from shift to the ascending colon and sponge packs is of appendix dangles here like a little worm and often removes in the case of appendicitis cases we will be removing. Nurses always check the right lower quadrant for the tenderness. From this image is of large intestine, we can understand the where is the ascending colon is present and a transverse colon and sigmoid colon and rectal anus and cecum is present. Starting is of cecum, excess of ascending and as of transverse and as of rectal and its end with the anus. We have seen the cecum nexus of ascending colon which climbs up after this and is roughly the 8 inches or the 20 centimeter long with the 2.5 inches width. Is like a tube. And here is also soak up of water and salt from the waste, flipping it up. And waste then turns the corner to the transverse colon. The process of dehydration hits this area harder. And we can increase the patient in the post-operative patients to take fluids. From this picture, we can understand where the arteries are present and how the colon is presented and what are the parts is there, descending colon and vermiform appendix, where is presence and what is the termination path of ileum. All these we can understand from here. The transverse colon is the longest structures over 18 inches or 46 centimeter running horizontally across your upper abdomen and right under the stomach and also its continuous ways of absorption while the waste travels in. This mobilization sections can sag with age and also in elderly care we should watch for the bloating purposes. Descending to the left side is a 6 inches or 15 centimeter, which is of left subabdomen, which keeps expanding waste into foam form and which is storing it briefly. Here we can things is of diverticulitis. Advice is of here the condition is will be of diverticulitis, which is can advise the patients of high fiber diet so that to prevent the pouches from the inflammation. We can know it's of rectum is of 5 to 6 centimeter inches and which is the largest part in the large intestines and reduces the liquid base by 1/3 of this original composition. The sigmoid colon is of S-shaped and the 14 to 16 inches is its finally is a pelvis it's building up here and the hemorrhoids and the obstructions may occurs here and also we got to teach the patient about the bowel training in the post surgery patients. Whatever we have seen in the applied anatomy is of a larger intestine. Here, what are the functions, and we have seen each part with the descriptions and also the blood supply in all the parts, and also we have seen the functions and enumerations, all that. These are the quick mind map for go through it. Just look into it. Reference. Thank you for watching SNS Park. Let's heal and learn together. Don't forget to like, comment, share. Any doubts? feel free to comment it so that I can reply to you soon. Thank you for watching once again, and thank you.